just going to move forward. We have a very important announcement to make. And without further ado, thank you for your patience and thank you for letting us fit everything in. I'd like to invite Marion Cooper, Dr. Simone Tanguay, and also Jane Soper Kennedy.
Hi.
Who is the chair of the Warren Y. Soper Charitable Trust, who has very generously supported us with this research project. We're going to make a special announcement. So, Jane, would you like to speak first?
Sure.
I'd just like to say, maybe you'd like to just share a little bit, who you are, and if you feel like it.
Am I on air now?
You are. Oh. You and I are having a conversation.
But not just you and I?
Nope, everybody.
Oh, okay. Well, good afternoon, everybody.
You look great today.
Better than the other day. Good afternoon. I am Warren Soper's daughter, and we have. Actually, I have for a long time, over 13 years.
Yeah.
Been supporting Kidney Cancer Canada since it sort of started a long time ago, with Tony Clark, and I'm really delighted and I'm honored to be part of this event, the Kidney Cancer Forum. I'm very privileged to be able to be part of the announcement of this year's recipient of this award that we're providing. It's my hope, and my father's also, to be able to make a difference in the progress and to diagnose kidney cancer, but most importantly, to improve the outcome of treatments. So I'm just very honored just to be part of the whole process. So thank you.
And we're so grateful. I know that you and Tony got it started many, many years ago, and you've been a big influence in Kidney Cancer Canada and Canadian kidney cancer research.
Right.
You've made a huge impact with all your winners that you have supported over the years. So
thank you.
I can't thank you enough. So I'd like to introduce Dr. Simone Tanguay as well. If Dr. Tanguay, you can join. And I think you're going to make an announcement of our winner for this year's Warren Y. Soper Kidney Cancer Research Grant.
Yeah, that's certainly my privilege. First, I'd like to personally thank Mrs. Soper Kennedy for this support, and the Warren Y. Soper Charitable Trust for the continued support of this award. I must say that we're very privileged to have this type of award. Is tremendous to acquire data that allows our researcher in Canada to then be competitive for larger grants that are so needed, if we want to move forward with research in kidney cancer. And this continued support is just tremendous for our community. So I just want to first to say thank you for this.
You're welcome.
This year we had 6 amazing applications. All of them, I must say, were outstanding. We met as a committee to review them all, and I must say that it was not an easy choice because they all deserve to be supported. Unfortunately, we have to make a choice, and fortunately for Cynthia Yee from University of British Columbia, who's our awardee this year for this Warren Y. Soper Charitable Trust Award, the title of their application or the grant is Clock Gene Signature in Peripheral Blood as a Marker of Dual Immunotherapy Response in Metastatic Clear Cell Renal Cell Carcinoma. This will be an exploratory study. So I think this is a very exciting study that can bring new approach for the treatment of kidney cancer. So Cynthia, congratulations on this amazing award. And I think we'll give you the chance to describe a little bit what this study will be about.
Thank you so much.
Congratulations, Cynthia. I wish you lots of success with the research this year.
It's such an exciting news for our teams, and I feel it's such an honor for me to be able to be here today and also share a little bit about our research. I do have a slide, so I'm going to start the slideshow. If you have any issue, let me know.
Okay.
Are you able to see that?
Yes, I can.
Thank you.
Okay. So for this study, it's a long title, but basically we want to show that timing really matters. Using the body clock to fight kidney cancer, it is an exploratory pilot study on clock genes and immunotherapy. And I am currently a PGY5, resident doctors in BC Cancer Agency in the Department of Medical Oncology. To start, let me see. All right. To start with, we are launching this to see if we can improve treatments success rates, not by changing the medication, but by changing the time we are giving it based on the patient's own internal body clocks. Immunotherapy is very common nowadays. You probably hear a different name, immune checkpoint inhibitors, immunotherapy, and other things. They really revolutionized the fields of cancer treatment, including kidney cancer. Think of this as a treatment, as releasing the brakes on your own body's immune system, allowing it to track down and destroy cancer cells. Very powerful tools. But unfortunately, it doesn't work for every single patient. And we struggle to predict who will respond best. By inspecting older data, we start to see that the impacts of timing of treatment outcomes, people with lung disease who receive immuno treatments in the morning seem to be doing better. However, this has been complicated because we do know there are people who do night shift work, there are people who travel across different time zones, and also people who feel better tend to come to the clinic earlier. So there's a lot of compounding factor we still need to figure out. Our body has this 24-hour internal clock known as the circadian rhythm. It tells us when to sleep and wake, but it also tells our immune system when to rest and when to be active. This can be complicated by personal preference, shift work again, and across different time zones. So this makes it difficult. Just looking at the watch is not sufficient for us to understand the internal body clocks. Instead, we find that there is some gene expression in our blood might give us some hints. Prior study have identified 14 genes, which we term them clock genes, that act like the gears of our internal watch. In this study, we're using a technology called RNA sequencing to make a snapshot of these genes. We hypothesize that there's a specific pattern, a clock signature, that can be identified in the blood and help us to better understand two things. One is that how robust is our internal clock is. Someone's clocks might be better than others. That might have impacts on their response. And second, whether our body is primed to fight the cancer at a specific timeline. Here's what we're going to do it. So we are aiming to recruit 60 people with advanced kidney cancer. Before they go into their first dose of treatment, we'll actually do a couple things. First, we want to get samples, blood sample from the morning as well as the afternoon to look at those 14 clock genes. Second, we're going to do a survey to ask them and to identify whether they're a morning lark or a night owl. And subsequently, we'll start the treatment based on our larger overall study that they will be randomized to morning infusion and also afternoon infusion. They will be part of the overall project called Chrono RCC. And ultimately, you want to look at if the patient's treatment time match their body's clock signature. Will they have a better outcome regarding tumor shrinkage, the survival time, compared to those who have a mismatch on those two things? This is an exploratory pilot project. If our results are promising, this can be applied more broadly. Ultimately, we hope to develop a tool where a doctor can take a blood sample, run the test, and say it based on your genetic testing, the RNA, we're able to tell you if you receive the medication at this time of the day, it will work better. We aim to prove that the timing of the drug is just as important as the choice of the drug itself, bringing us one step closer to truly individualized cancer treatment. This project cannot come so far without support from the team, Dr. Comensberger, Dr. Osgon, and Dr. Hatch, and it cannot move forward without your support. Thank you very much.
Oh, thank you, Cynthia. And thank you so much for putting that into patient-friendly language, because I was honored to I didn't participate in the review panel, but I did read all of the applications, which, as Dr. Tongay said, were excellent. And my goodness, reading that and your explanation are like two different worlds. So I truly appreciate that you put it in patient-friendly language so that we can truly understand. And what a novel idea, you know, like to discover that, you know, time of, you know, infusion or medication might make a huge difference on how well the outcome will be with your cancer treatment. So I'll be very, as we all will be very excited to hear your results. I'm going to invite Marion Cooper, who is also involved in along with these research studies. Marion, can you join us and did you have anything that you'd like to add?
Well, I'd just like to congratulate Cynthia, but also wish you well on your research. This, you know, research like this is so encouraging for kidney cancer patients, and the opportunity to kind of hear about it is really exciting for us. And of course, Jane, you know, your support and your commitment to Kidney Cancer Canada really are remarkable. And we're so thankful to you and the foundation for this like steady commitment to this incredible work that we're seeing, which has really made a difference in the kidney cancer treatment options. So awesome. It's really, our hearts are full because you just show up, and we're so thankful. And Dr. Tangay, thank you for your medical leadership within our Kidney Cancer Canada organization and the medical advisory, and leading, you know, the deliberations around our decision around the award for this year. We really appreciate your guidance and your leadership. And today has been just yet another, I think, amazing day. It was so diverse in the presentations and the conversations, and really grounded in lived experience, the patient experience, and whether that's about developing a tool that's you know, more user-friendly for patients and caregivers in a comprehensive way, whether that's been sort of being, you know, getting accurate and updated information around nursing care and pre-op and post-op care, around surgery and the important role nurses play. And of course, the important role that our urologists play in terms of kidney cancer treatment and surgeries, and how far we've come with so many more options than we had 20 years ago. So it's just been so packed for me. And, you know, Christine, I got to thank you for your leadership. You know, you made our conversation today really feel really accessible, and your warmth and your ability to connect with people is so special. And Kidney Cancer Canada is very thankful for your leadership, and in particular, your leadership around patient engagement and really grounding our work in such a good way, reaching so many people, and for organizing this forum. And thank you. Yeah.
Thank you, Marion. That's very, very kind of you. Well, yes. Jane, did you want to have any last comments or?
No, not really. But
okay, I know that you and I and Dr. Tongay will be, and Marion will all be anxious to see the results of Cynthia's good work. And so we'll wait for that. And I will let you go, and thank you. Marion, I'll ask you to stick around for a few minutes, but thank you so much for joining us today in this important announcement.
Well, thank you for asking. I love it.
Thank you so much.
Have a great night.
Thanks. Thank you. You too.
Thank you.
Thank you,
Congratulations, Cynthia.
Congratulations.
Take care.
Okay. Bye-bye.
Bye.
Bye.